Hi, guys. Welcome back to another episode of Dana with the Data. And I have Dr. A. It's been a long time, a minute, since she has been up here. And I love having Dr. A on. And I have also Miss Cherie Peoples. I interviewed Cherie Peoples last year in 2024. And it was about politics. This was the election summer. And, Miss Cherie Peoples, you had your run-in story history with Kamala Harris, which made national news. But we're not talking about politics today. This is about health. Um, and we're going to be talking about sickle cell, a disease that is really not talked about a lot in our society, particularly in the Black community. But we have Dr. A here to give us the medical expertise. Cherie, please introduce yourself.
Well, I am Sheree Peoples.
Sheree. I'm so sorry, Sheree.
It's okay. I am Sheree Peoples, and I have a daughter who has been diagnosed with sickle cell SS since she was born at 2 weeks old, and she is currently a young adult, so she is 23, living with sickle cell anemia.
Yes. And Dr. A, introduce yourself.
Well, good morning, afternoon, or evening, whenever you're tuning in to Dana with the Data. Yes, she and I are like sisters now. We've been riding out for maybe 5 years talking about women's health and advocacy, sometimes with Judge Joe, sometimes on Man Up. Today is spectacular because this is part two of our discussion with Sheree. And Sheree talked to the judge and myself all in the first segment. So now we're breaking it down. Dana with the data, like she always does, has compartmentalized the medical versus the political legal aspect. So we're dealing with the medical, which is fascinating to me because to catch you all up, audience, Sheree went through some horrific things because of propaganda and a stupid narrative. The narrative was, I don't believe children should be truant or not go to school. This is America. We have public education, which we're about to not have. Okay. We're doing away with Department of Ed. Ain't gonna be no more free education. That's why charter schools started in the past 20 years, is to undermine public education. So where I live in Gary, um, the money has been defunded from public schools. Talk about defunding the police. We're defunding our children. We've defunded public schools here in Indiana, and we only give money from the state at the level of Indianapolis to charter schools in Gary. If you're a little Black or brown kid and you're not in a charter school in Gary, you're up the creek because you're about to either go to prison or back onto the plantation. And that's the plan. Now, I am a board certified OBGYN. As you can already hear, I'm a health advocate. I'm not here to talk about me. Google me, look it up, do your homework. I'm here to talk about Sheree and her daughter because what she went through was horrible. She was literally taken to jail postpartum. I mean, that's damn near what happened to, you know, uh, uh, Asada. Asada was handcuffed to a bench, listeners and viewers, back in the 70s by the New Jersey Turnpike Police, New Jersey State Police. Still a vicious attack on Black people, even now in the 21st century. But she was handcuffed to a bench pregnant, okay? Because she was such a threat as a Black woman. Well, no, we're not talking about the 70s. When did you get arrested, Sheree?
I got arrested in 2013.
And your baby was how old?
My infant son was 3 months old. He was born in January.
So this is what we're here to talk about. She battled with her adolescent at the time who suffered a stroke as a result of stress from her arrest.
Yes.
Immediately postpartum. I mean,
All right.
it's sickening. So that's why Dana decided this needs a part two.
It needs a part two because I want to emphasize on the disease sickle cell.
The
So,
sickle cell is a hereditary condition, and this is the most important part. Is the oldest hereditary condition in the world. It wasn't even discovered in America at first. So there's two discovery dates for sickle cell anemia. So us as being that we are in February, and this is African American History Month. it's really good to understand the history of sickle cell and understand the prevalence, because it's a powerful thing to have the trait of sickle cell. It saved us as a people. It saved us from being destroyed by a mosquito.
You
And
got
that's
it. It was a survival
the
adaptation. You
survival
got it.
mechanism. And because of that, and two traits mate, caused the severe condition of sickle cell. Unfortunately, and because all of the major organs with sickle cell are affected, which makes it also very difficult to control. And as being a mother of an adolescence, from infancy to adolescence to now young adulthood, I can see the stress and the things that we go through as parents and how it hinders us in order for them to live a healthy and efficient lifestyle, because it's something that just, not to say it just happened, but it literally just happened. I can go check on her and, oh, I'm fine, mom, and 2 minutes later she's in severe crisis. So the crisis, because of the limited oxygen that's already in her body, and it's being blocked by whatever reason, because her blood can be thick, so like mucus is hard to pass through, it get blocked and it causes severe pain. That pain, in which in turn is hard on us parents, because I have to watch her and see her go through this pain every day. And it's not one day that she says, "Mom, I'm pain free." And it's so sad that a person with sickle cell, or any person with sickle cell, go through the things that they go through in the hospital setting, in the educational setting, in the workplace setting, and then also as a parent, in order to give them the good pathway to success, trying to figure out on the way. And then unfortunately, like in my case, trying to figure it out led to my arrest. And so the goal is to educate parents in order for them to advocate for their children, but also teach their children so they can learn how to advocate for themselves. Because the biggest thing that I see is most young adults do not understand their condition. Us as parents are afraid to tell them. We are afraid. We're dealing with so much, going to work, trying to figure it out. If we can get FMLA, our kids, our job is at risk, our livelihood is at risk, all because of our children's condition that is very unpredictable.
Dr. A, you want to add on to that?
Sheree, first of all, thank you for the courage to stand up and be transparent and tell your story on behalf of your children. I just want to give a medical lens to what she's saying as a woman and as a mother. Sickle cell anemia is a blood condition. It's a hematologic, is the medical word. What does that mean? It involves every aspect of your body, every cell of your body, your brain, okay, your lungs, your heart, your kidneys, your liver, your spleen, all the muscles of your body, all of them, okay? And muscles come last. Oxygen priority is organs first. So many sickle cell patients are in extreme crisis because the blood circulation is horrible. Okay. She said thick blood. That's an understatement. Our blood is basically what, viewers? It is water and powder, just like Kool-Aid, just like any beverage. The powder are the cells, the water makes it move. So, one of the most important cells in the water is called your red blood cell that carries oxygen. That's all jammed up. Okay. So your red blood cell is not efficiently moving oxygen. Well, we live on oxygen. We don't have a substitute. Ain't no backup plan. Okay. So when your brain and your heart are not getting oxygen, you feel like you're dying. It feels like being drowned. It feels like death. When your muscles are deprived of oxygen, it feels like death. So essentially, while this young Black girl was experiencing a hereditary condition she was born with, had no control over, no lifestyle adaptation can change sickle cell trait or hardcore sickle disease. You're born with it. You can be cured by cord blood. That's a whole nother segment. But if you're not cured, you got it. Okay.
You got
You're
it
going to go through
100%.
pain crises. And
Yes.
when she went through her pain crises, where she was feeling as if she were being drowned in the ocean, her body being deprived of oxygen from the muscles to the organs, including the brain,
And it's so bad, even a
Hell no,
car
she
ride.
couldn't go to school.
The
So
car
then,
ride is
when her
very
mother kept her
painful.
home and gave her pain medication or hospitalized her, the woman was arrested for truancy. That's what we're talking about today.
And it's sad because for her, even the car ride was very painful. I think it was more painful than anything at all, even when it came to the modifications of her 504 plan, because she had a 504 plan. She always had a 504, which is a reasonable accommodation plan to allow the student to be accommodated. So that accommodation can be water at your desk, being able to get up and go to the bathroom as frequently as you need, being able to take a test in a separate room. These are all modifications that can be done outside of an IEP, which is something totally separate. That is a individualized educational plan that is for if you're behind in learning, and which Shayla is not behind in learning. She just needed to be accommodated. And part of the problem with when she was in the elementary, junior high school setting was the fact that she was riding the school bus. And if you know the school bus, it's very bouncy. That vibration was also causing pain crisis. And the problem that I had out of everything is the fact that the school district was being doctors. They were trying to tell me how to take care of my child. And that is something that I truly is against, because nobody don't understand. First of all,
Well,
they
that's
wasn't able to give
unethical.
any
First of all, that's unethical.
narcotics.
It's unethical. It's unethical. For me as a physician to pretend to be a teacher, lawyer, or accountant is fraudulent. I'm a doctor, okay? For an educator, and my mother is a doctorate level educator, she ain't no doctor. So, no, you don't cross lines like that. That was unethical behavior.
And that's kind of what led up to the arrest, is because I refused for them or for her to go to school en route when I needed to actually take her to the emergency room. And sickle cell, anytime you have a fever, it can be a low grade fever of 100.4. You still need to call your doctor and let them know that they're at a breaking point of a fever so they can give you instructions on what to do. It's just sad because the type of treatment that is available that they call a so-called cure that they just recently launched when it comes to the stem cells is the fact that the majority of us will not have the type of insurance that we need in order to cover it. Most
Bingo.
insurance do not cover stem
Bingo.
cells, right? So therefore, they're giving us a so-called cure that almost act if you're getting cured for the stem cells for the bone marrow, that you still have to suppress your immune system, which most of these kids' immune system are already suppressed, which a lot of them still won't qualify for the millions of dollars that it would take for them to continue to be followed up for the rest of the year
You
because of
got
the
it.
stem cells, which is still not covered by the insurance, which 80% of them, if not more, it's on some kind of state funded medical plan.
Right.
So it tends to hurt. Most of us are minorities. A lot of us cannot work full-time jobs. This is a huge problem within the community, is maintain work so we can have a proper health and coverage and health insurance. And then on the flip side, we're not able to be there because we have to go to work and be able to still provide for our families. But what I was saying was, when it comes to these cures or so-called cures that we are putting on the map for our children, and my personal belief that we need to raise them in order to receive this treatment. Their bodies have to be prepared to receive these treatments. Most of the young adults may not qualify because they already are at the level of risk of having a stroke, been on way too many medications to be able to qualify, have way too many blood transfusions, because that is also
You're
part
right.
of the assessment. So when you're assessed and they're trying to figure out if you qualify for the transplant
You're
services,
right.
the majority of them will not qualify. What I thought in myself was saying, hey, if we raise our children for their bodies to be strong, where they're doing the penicillin from 0 to 5, those children will have a better outcome
You're
with
right.
these services outside of the ones who've already been dealing with the damage it already caused to their organs. So if you're talking about immunosuppressing their organs, just like a person on cancer, they have to go through that same treatment. So therefore, if we're not raising our children appropriately to be cured from day one when they're getting the diagnosis, it's not going to work for the ones who already have the extreme damage, which is the ones who are looking for the cure and our insurance don't cover it. It's like a win-loss situation that we won't even be able to benefit from. And that is
I
the
wanna ask
sad
you a
part.
question. Why is it that a lot of young adults don't even know they have it? Is that's what you said earlier?
Yes, what I said was earlier is that the fact that they don't understand their sickness, a lot of parents are afraid to talk. I got scrutinized by so many sickle cell patients, parents, because I was teaching my daughter at a young age, because I was explaining to her what sickle cell was. And I can give you a vital moment with that. It was a young lady. Shayla was really young. She was sitting in the ER for hours, and she was African American. I gravitated towards her, and she was like, "Can you please help me? Can you please help me?" And come to find out, she has sickle cell. And I was like, okay, let me get you, into a room. So I went to advocate for her, let them know, like, hey, we got this young lady. She's sickling. She's in pain crisis, X, Y, and Z. Me
Mhm.
and her became very close. And what I learned with becoming close with her, that she did not understand her diagnosis and how to advocate, because her mother, and first of all, she wasn't sick like that as a child. She didn't get sick until an adult. So if you're not having these complications as a child, and then you don't have the opportunity to learn or to learn how to advocate, it's all your parent doing the talking for you. So when you're now an adult and your parent just drop you off at the emergency room and you're there to defend for yourself, you really only feel it. You just, like, I feel sick, I know I have some, but they don't understand the complexity of sickle cell. They don't understand the true nature
Makes
of it,
sense.
because their parent did not allow them. They just blocked it out. Oh no, they didn't have the
That makes
conversation.
sense.
That only conversation only happened if they're hurting, or they go to the doctor once every 3 months or once every 6 months,
So let me ask you this
depending
though,
on
because
their
the 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 patients that did not experience sickle cell severely when they were younger,
Mhm.
the parents may not have been as knowledgeable as you because their kid wasn't as bad with that disease. Do you get what I'm saying?
Yes
So
and no, because they
okay.
do hand out a pamphlet, like a sickle cell handbook, so to speak, and they still have to be followed for the first 5 years. So at the end of the day, they're still on penicillin, and that penicillin you have to get refilled every 14 days as a liquid until they're old enough to take the pill that is more sustainable. But at the end of the day, they still have to be educated. As a parent, when you're coming in with a newborn, you go through this whole, for me, this is what I went through, a whole scenario, doctors coming in, knowledge as much as they give me, but it was up to me to finish the research. It was up to me to figure out, okay, they have a possibility of a stroke. And it can be different between boys and girls. It can be different depending on what I call other variances, right? Some people have two parent households, some people don't. What are the other stressors that is a part that can contribute to the condition? But a lot of parents, from what I have found, do not have those real conversations for them to truly understand their condition. So as they get older, the more you can pour into that, so they can be able to handle it as much
Right,
as they can,
right, to have
age
the knowledge.
appropriately. Yes,
So
because
let me ask this question here because, and this is for you and Dr. A. Sickle cell, the disease sickle cell, right? Sickle cell. Is there enough conversation that healthcare providers are having with patients? Is there enough awareness? Is there enough research, answers, training, or is it limited because the medical field, the medical industry has not been investing enough time and maybe and also money into understanding sickle cell and coming up with multiple remedies or drugs or possibly a cure for it. So is the conversation limited in the health industry in the medical field?
yes and no. It depends, first of all, where the patient reside at. Is there a lot of populated of us there? because that can determine the level of expertise that you will receive at your medical office, or if they have a hematology clinic, where are you going? So it's a yes and no. A lot of us will feel like, okay, we're experts, and sometimes it can be the physicians who are not listening. It can be us who is not listening. A lot of times they go based off of blood work. And the blood work may show one thing and we may feel or see something else. And then we tend to bump heads because they're looking at it from a scientific perspective. And we're looking at it from something from a mother perspective. So it tends to be that for me, to say that we need to be educated. I feel like it's the outside world who needs to be educated, depending on how much the child gets sick. Sometimes they're not as affected and sometimes they are. But as a parent, we should be educating ourselves so we can educate our children, but also educate others. And that means the teachers, that means, just everybody they come in contact with. And that is the main issue, because
So I
half the
want
time,
Dr.
I
E
feel
to
like
chime in
parents,
on that as well. I want Dr. A to chime in.
So, Dana, your question is multifactorial. So, number one, you're asking about education and training. And I will tell you flat out, sickle cell is not complex for a medical professional. I don't care if you're a nurse, nurse practitioner, physician assistant, or a physician. You cannot complete medical training and not comprehend blood circulation and sickle cell. Okay. So, it's sort of like passing algebra. All right. It ain't the hard stuff at all. It's not the weeder. Okay. There's complicated stuff like various cancers. Okay. Complex high risk pregnancy that really trips your brain up as an intellect. This ain't one of them. Okay. This is real basic. And so everybody that's a medical professional, you better believe globally, not even just in the United States. Okay, a foreign trained doctor can come here. They still train and they understand sickle cell. That's not the problem. Communication is the problem. So, as Sheree was alluding to, and I'm going to put it even more bluntly, okay, we all know Luigi Mangione committed murder. Why? Because of stuff like this, okay? The medical system is set up as such. There's not a relationship between doctor and patient anymore, like when I chose to become a doctor. The relationship is it's a trifecta between doctor, health insurance, and patient. And you better believe they smack in the middle. So because of that, Dana, they pull the strings of the doctor like a puppet. Okay? They say, dance, doctor, dance. See 40 people a day. You ain't got the time or the energy to sit there and go into detail explaining something to somebody that they can Google or research like Sheree did. Okay. If your child got this, that's your baby, do your homework. The time of relying on the police officer should like me, the doctor should teach me, and the teacher should love me. Okay, wake up. It's not going to happen. The officer is not always officer friendly. Some love you, some hate you. The doctors, some care, some don't. They all get paid, period. Okay. The teachers, some are invested, some ain't. Wake up. Who's supposed to be invested? The parent. Sheree is making me think what we need to do, since only 5% of all American doctors are Black. And it's been statistically proven that in the NICU, for example, if that little NICU baby, 1 pound, struggling for their life, is Black and has a Black doctor, they got a better outcome. So, whatever you want to ascertain that to, more compassion, more empathy, whatever. Okay. Black doctors carry more onus than our counterparts. And so, what we can do, along with Black nurses, nurse practitioner, and other health providers, but starting with physician, because y'all know the most. We do. We train the longest. Period. That's not up for question or debate. Okay. We put in 5 times more hours at the minimum. Okay. Hour to hour. So, yeah, don't lose out on your doctor's knowledge. That knowledge they done sacrificed decades for. Okay. All my children's lives were sacrificed for the knowledge I have as power to speak into this community. And so, therefore, what doctors and other medical providers can do, Sheree, is develop advocacy organizations where we are not in the puppeteer's office. We're on our own dime. Okay. And we are talking about sickle cell. And even companies across this country that are profiting from sickle cell patients,
And
they
that's just
really need to become
basically,
sponsors of advocacy in communities of color, divesting from DEI or not. DEI, for the most part, benefited Caucasian women,
it did not
not
benefit
people of
us.
color.
Absolutely
So,
not.
people of color, forget the narrative of DEI. What we deserve is our get back. We are disproportionately affected by sickle cell, and we are the consumer. Our get back is sponsoring advocacy organizations in our community.
Yes, ma'am. I do extremely agree because the DEI did not save me at all. It was nothing about what I experienced um, that benefit from the DEI at all. Even when it comes to sickle cell and at the hospital, we are on the hematology oncology floor. And what I've learned is that we kind of piggyback off of the oncology side. So we are separate but equal.
That's
Even
true.
in the
That's
hospital,
true.
we are
Right?
separate but equal in the hospital. And a lot of times we don't even
Right.
realize that we are piggybacking. And I learned this the hard way because my daughter was participating in the program and I wanted her, and it was a pain management program, and they were using her to collect data. And when I tried to get her to be a part of this program, they told me no. It was for cancer patients only. But yet, you wanted to utilize my daughter likeness, her voice, her intellect in order to develop something that wasn't even meant for her.
You got it.
And it was being ran off of oncology. Even though it's hematology, oncology, we are separate but equal. We were still under the Jim Crow in the
Yeah.
hospital,
Yeah.
point blank, period. And if you don't advocate for those dollars to go directly to hematology, our our patients cannot touch nothing
All
that is a
right.
part of that program. And guess where all the donors go to? That's so our children see it, but they can't touch it.
You
Oh,
got it.
you can step at the door and look, but you can't be a part. So as I was at the hospital, and this was pediatrics, and not to say on the adult side, but as a pediatric, I'm like, how in the world we can, this ain't right. So I had to advocate and say, hey, do you know this is separate? Hey, can you make sure that some of the funds can go to hematology? Because that is the discrepancy. And I feel like part of it is set up that way so we can't get it. Like the cardio and pulmonology, every department is separate. It's just like a mall, and each store in that mall is different. It's the same way at the hospital. And when I
Right.
realized that it was nothing but a big propaganda, nothing but a big old advertisement, because if you look on those walls that says donors, look at the sponsorships. Look at all the major corporations that donated. Look where
Bingo.
those don't though that money flow goes to, but it's not going to the children that really need it or the family that really need it. Where is DEI for that? And again, like I said, for me, it felt like nothing protected me, because if that was the case, I would never went to jail for just trying to protect my daughter, trying to make sure that her health is well and well-being is in place. The fact that the 504 didn't work, where was my protection? Because I did have a 504 plan, which is reasonable accommodations, which is a federal document that didn't even help me. So it's like, what is the purpose? It helps her, but at the end of the day, as a parent, to advocate for a child or any parent or elder person that is unable to advocate for themselves, to be criminally held to that, has really done something to me. And I didn't realize what it did, what it activated, what triggered me, it's not fair. And no parent should be criminalized to try to keep their child alive. No parent should have to go through all these little terms, and it should be comprehensive care. That's what it should be. And especially in the adult side, which is totally worse than the pediatric side. And the fact that since COVID, it has really changed because our transition period came during COVID. So our transition wasn't even appropriate because the healthcare industry is not the same post COVID. If
No,
you go
it's
back
not. It's not.
before COVID, it's
It's
not the
not.
same. And it's so sad because you can't even switch doctors the way you used to. You can't get a new doctor because that takes 3 to 6 months, if not longer. And when you have a child that is chronically ill, that forever needs medication, that needs support and services, it's hard. It's very difficult. And I'm like, I wish I was able, not to say we didn't have COVID, be able to transition her appropriately because there's so many services that got lost. We don't have anymore. Or we had to transition just blindly. And I wasn't even able to be there with her because it was COVID.
Sheree, let me just clarify this for the viewers as well as myself. Two things that you talked about in the first segment, but I know we have a lot of new viewers that did not see that. Number one is the consequence to your daughter of your arrest, her having the stroke and what happened from that. That's the first thing. And the second thing to clarify is where geographically you live, what we're talking about in a very real live way.
Where I live at is in Orange County, California. Geographically is primarily Hispanic, Caucasian, Asian. It's kind of a mixture, but it's not a lot of us out here in Orange County. I'm more what they will call North County, which I'm closer to Disneyland, Knoxbury Farm, little entertainment area, which is primarily minorities. Basically, we're the ones who will service the Disneylands. We're the ones who will, do the
Mhm.
housekeeping. So you have a lot of Hispanics in this area because of the service they provide for the more higher up in
I
the.
call them first responders.
There
Okay,
you go.
that's
So
what it is.
so yes, I live out here. And as what was the first question regarding Shayla's stroke?
About as a result of your arrest, she suffered a stroke and what that
Yes.
really meant for her.
Oh, the suffering of the stroke, what it meant for her was a change of life, a change of lifestyle. She lost a piece of something that she can never regain because she is physically paralyzed on her right side, on her dominant right side. Um, so it left her needing more support. Um, it's, it's it's really really hard because to see her struggle and can't tie her shoe, or to see her um, I don't even have the words.
Basic stuff that we do every day that we don't realize when it's taken away from us, like it means so much. So just basic, I guess, basic
As
daily.
a parent, it hurts because I really wanted her to go off to college. Even with her having her sickle cell, she's able to, go out and spend a night out with friends or do different things. And now to add that extra layer with the stroke, it's even more difficult for her to maintain those friendships and to go out because her equilibrium is off. So I'm always, Shayla, don't fall. Shayla, watch your step. Shayla, do this. She has to be mindful um, of what she wear if I'm not with her, so she can be able to take her pants on and off and buckle and all that kind of stuff. Um, it really left me 100% of her caretaker
That's
and
right.
trying to figure out what can I do as far as living my dreams and doing what I want to do in life. So trying to find that balance. So I say, okay, Shayla, we're gonna have to hire you an assistant type thing and come up with a plan for for me to be able to still make sure she's okay, so I can still, write my book and do the things that I dream to do, because at the end of the day, I still haven't stopped dreaming. I still have dreams and aspirations, and I know she does. So trying to find that middle ground for the both of us has been part of the challenge. But as far as her stroke is concerned, it has really changed our lives. It really changed my life because it really set me to be her 100% caregiver,
That's right.
um, and really can't work a full time job the way I would want it to. I'm on call 24 hours a day.
20
So
24-hour caregivers. Not it's beyond 100%. It's like 24 hours, 7 days a week. You have to be
That's
there full
right.
time. Yeah.
mhm. Yeah, so I try to find ways, and we've been talking about and having open conversations so we can figure it out. Here lately, she hasn't been feeling too well. Trying to find that healthy balance and making sure she's okay. And I think the hard part for me is that it affects me financially, and trying to get that balance financially is why I'm pushing hard to do my podcast and to finish up my book.
I want you to tell me the name of your YouTube channel, the name of your podcast, and then we'll talk afterwards.
Oh, that would be so cool. I'm so excited. So it is Talk with Miss Peoples is the name of the podcast.
Go and subscribe to Talk with Miss Peoples. That's the name of it, right?
Yes, it's Miss People's podcast.
Miss
So I'm
Peoples
bringing it up.
Podcast.
Yes.
Okay. So I
That's
want
what
you
it says on
to go
YouTube.
and subscribe. We want to get her to 100 subscribers by the end of the day. So when this airs and people watch it, go and subscribe to Sheree's YouTube channel and watch the videos. And then me and you'll talk after this. Sheree Sheree. I keep saying re because of the E, but it's
I
Sheree.
know it's Sheree.
You created it so you could put the hyphen yourself up here. So it's Sheree People's Podcast, and that would be at Miss People's Podcast on YouTube. She has 78 subscribers. When I check her YouTube on no later than Tuesday, I want to see over 100 subscribers subscribing to her channel. All right, guys. So listen, go and subscribe to Sheree People's YouTube channel. The link will be in the description and in the comment section. Go and subscribe, and we will be back next week with part 2 to this conversation. Thank you.
You're welcome.
Sheree. So thank you so much again for coming on. And we'll talk soon. So we'll do the part 2. And we'll see you guys next week with part 2.
Dana with the data. Dana with the data.